1.8 Lying about experience. You are working as an FY1 in the medical assessment unit. You have been clerking a patient with suspected meningitis. The patient requires a lumbar puncture to help diagnose his condition. You inform the medical registrar of this, and he agrees to supervise you while you perform the procedure. You have seen many lumbar punctures in the past few weeks and have received practical teaching about the procedure on models. You have never carried out a lumbar puncture on a real patient before. You consent your patient, warn him of the risks of the procedure, and get your equipment together. As you are about to start, your patient leans round and says, "You have done this before, haven't you?" Rank in order the following actions. In response to this situation, 1 equals most appropriate, 5 equals least appropriate. A. Ask the medical registrar to complete the procedure. B. Ask the medical registrar to talk to the patient and explain the situation. C. Explain to the patient that you have received training and seen the procedure done many times and that you will be supervised throughout. D. Tell the patient that you have done lumbar punctures before without mentioning it was on a model. E. Tell the patient you have done many lumbar punctures on several patients. Answer: C, B, A, D, E. It is the nature of learning a new skill that there will always be a first time to complete a procedure. As a foundation doctor, you are allowed to perform procedures such as lumbar punctures, pleural drains and ascitic drains, as well as the core procedures required by the foundation program curriculum, as long as you have had the relevant teaching and training and have appropriate supervision. When completing any procedure, you may often be asked by the patient whether or not you have performed it before. It is always essential to be honest with your patient, and the General Medical Council makes it very clear that every doctor should maintain integrity and honesty with their patients and colleagues. Option C would allow you to be honest with the patient, while also offering them reassurance of the fact that you will be supervised during the procedure and maintaining the learning opportunity for yourself. The patient may also be reassured after an explanation from a more senior and experienced doctor, so asking the medical registrar to explain the situation could also be helpful. B. Asking the registrar to carry out the procedure A will ensure that an experienced doctor is performing the task. However, this would remove the opportunity for your own learning and development. Option E ranks last because lying to your patient is completely unacceptable, and this response would display a disregard for patient autonomy. Option D involves an omission of the truth, which, although preferable to lying outright to the patient, is still misleading and therefore also inappropriate.